This chapter on immunizations covers all the currently recommended immunizations for children. Probably the questions that you're going to get are going to be dealing with not so much what should you get at each age, but what vaccines are given for each situation, and some general rules about giving vaccines. A couple of definitions. You need to know what they're talking about so you can actually answer some of these questions. And a vaccine is a suspension given to induce immunity. It can be active or passive immunity. A toxoid is a modified bacterial toxin. Now it is no longer toxic, and will stimulate the production of an antitoxin, and that's how you get your immune response to prevent disease. Active immunity is the antibody is produced in response to a stimulus, whereas passive immunity is preformed antibodies are given to the patient. A classic example of passive immunity is giving Rh immune globulin to the mothers to help prevent the Rh sensitivity and hemolysis when the baby is born. You're given preformed antibodies. Herd immunity means that if you immunize enough people in the general population, then it is very difficult for someone who is not immunized to get the disease because they can't get it from anybody because those people don't have the disease. Sounds really good in theory, but in principle it's hard to achieve because you need about 90% immunization rates to achieve herd immunity. And in this country, before school starts, we have some immunizations rates that only approach 50 to 60%. And therefore, you can see how diseases are being transferred all the time or transmitted. We'll discuss the active immunizations first. You need to know live versus inactivated. The live attenuated vaccines, you need to know which they are because in some certain circumstances, for example, a patient that is immune suppressed or immune compromised, this live vaccine, even though it's attenuated, it can cause disease in the patient. It will not cause disease in a normal immune competent person. These vaccines include the measles, mumps, rubella vaccine, the varicella vaccine, and the nasal influenza vaccine, which is a live attenuated vaccine. The other vaccines are not commonly given in this country, so we're really not going to discuss them. Inactivated vaccines include the diphtheria, tetanus, and acellular pertussis. Everyone calls that the DTaP. The hepatitis B and hepatitis A vaccines are also inactivated vaccines, as well as the Hib conjugated vaccine. The parenteral influenza vaccine as opposed to the nasal influenza vaccine. So the parenteral is inactivated, the nasal is a live vaccine. The meningococcal and the pneumococcal vaccines are also inactivated and conjugated vaccines. A couple of rules about giving vaccines. This may be information that you need to answer a question as to, they may give you a scenario where a child presents in a certain manner and they'll ask you what vaccine should be given or how many or when, and you'll be able to answer them. You can give different vaccines given by different manufacturers. They're basically the same, so you can go ahead and change manufacturers. Most vaccines can be given separately, simultaneously, but at separate sites without any problems. These are the exceptions: cholera, typhoid, and plague. Now, these are not common vaccines that you're going to be giving here in this country, but remember them as an exception to the rule. But most of the other vaccines that we have can be given safely at the same time, but just at separate sites. This is a really important point, is the next one. If there's a gap between vaccines, so let's say the baby was seen at 2 months of age, now the baby is 1 year of age and has not had any vaccines in between, do not start all over again. Just pick up where you left off, give the vaccines that were due at 4 months of age, for example, and any other vaccines that may be pertinent at 12 months of age. So another rule of thumb is give as many as you have when you have the child there, as many as you can give. Live virus vaccines can be given on the same day without any problem. However, if they are given on separate days, you have to wait at least a month before you give them. That way you get better efficacy. So remember these little points because they could ask questions based on these things. A couple other rules about vaccines. If you don't know their status, then pretend that they did not have immunizations. So if the immunization record is lost, you start from the beginning with any of the age-appropriate vaccines that are due. If the record is, for whatever reason, doesn't look reliable, start from the beginning. Always assume the patient has not had any of the vaccines and start from the beginning. They have to be on a formal immunization record to actually count. It can be from another country, that's okay, as long as it looks, you see the record and you can see the dates and all, and then you can make your determination as to what vaccines are needed. Always give the recommended dose. Don't try to give a double dose or less, or else you won't get the right immune response. And another important one is, if a patient has received gamma globulin for whatever reason, you must wait before you give a live virus vaccine. And the window is usually 3 months. So if the patient has received, for example, intravenous immune globulin for Kawasaki's, because you're worried about coronary artery problems, this child must wait 3 months before you give them any live virus vaccines. That's an important one to remember. Once again, we talked about this with the autism chapter. I have to stress there is no evidence that giving the measles, mumps, rubella vaccine actually causes autism. So go ahead and give it. And recently there's been a flap over thimerosal and causing problems. Thimerosal is a preservative used in the vaccines, and it was felt that it caused high levels of mercury. There's never been any correlation between thimerosal causing any mercury-related problems. However, that issue no longer is a valid point because the vaccines have the manufacturers have removed thimerosal from the vaccines. A couple of precautions and contraindications. First of all, you may get a question where a child comes in and is due certain immunizations. The child is otherwise healthy and normal except for a mild cold and a low-grade fever, and they might ask you what to do. Go ahead and give the immunizations. There are very few contraindications to immunizations. One of them obviously is allergy to any of the components. But as far as mild illness, colds, respiratory disease, not a contraindication. If you have severe illness, high fevers over 102, if you have pneumonia, then yes, you do delay giving the immunizations until the patient is fine. Egg allergy is no longer considered a contraindication to the MMR vaccine, because of the way that the vaccine is manufactured. Influenza vaccines and yellow fever, however, do contain egg protein, and therefore they are contraindicated in egg allergies. MMR, no. Yellow fever, influenza, yes. If there's anaphylaxis, like I mentioned earlier, you have to worry about that, and obviously that's a contraindication, and you need to know what the components are. So for example, in the MMR vaccine, which is very common when it's given, it contains neomycin, streptomycin. You should not be giving it if the patients have any allergies to those antibiotics. Breastfeeding is never a contraindication to giving the vaccines or delaying the vaccines. You just go ahead and give the vaccines if they're breastfed. And the only vaccines that are recommended during pregnancy are the ones that are listed below: tetanus, diphtheria, and influenza. All live virus vaccines are contraindicated. You certainly do not want to give the measles, mumps, rubella vaccine to a pregnant mom, female, because then she is at risk to have, the fetus is at risk to have rubella and develop congenital rubella syndrome. That's a common question. The mom comes in and she has not had rubella or the vaccines. Do not give it to her until after the pregnancy. The other way that you can ask the question is, the mother is here with her 15-month-old. The 15-month-old is due the MMR vaccine. The mother is pregnant. The mother has not had rubella or the vaccine. What do? It's okay to give the vaccine to the child because the mom is immune competent. Now, she may not have had the disease and she may not have had the vaccine, but since she's a normal, healthy female, she's not going to catch the disease from her child who's getting the vaccine, and therefore you're not going to have congenital rubella syndrome. However, you do not want to give live virus vaccines if, for example, in the question they say that the dad is on chemotherapy for some malignancy, now that dad might get rubella or measles actually from the child, even because it's a live attenuated vaccine and he is immune compromised. So if mom is pregnant and she's immune competent, it's okay to give the vaccine to her child. A couple of others contraindications are with specific diseases. So if you have the X-linked A-gamma globulinemia, which we're going to discuss later on, Bruton's, you do not want to give the oral polio. Just as an aside, nobody gets the oral polio anymore. Everybody gets the killed polio, the inactivated polio. There used to be about 9 cases a year of what we call vaccine-associated polio, where you would give the oral polio and then the patient might get the disease. Well, we've eliminated that by just going back to the old killed polio, so no one should be getting the oral polio anymore anyway. And these are a couple of lists of other vaccines that should not be given to patients with the X-linked A-gamma globulinemia. Patients with severe combined immune deficiency should not get any of the live vaccines. Patients with complement disorders have no contraindications for the vaccine, so they can get whatever is due. If they have a phagocytic component to their immune deficiency, then you want to avoid the live bacterial vaccines. That would be contraindicated in those patients. A very common one to get asked on the exam is a patient that has HIV, and what vaccine should this child get or should this patient get? Certainly, you do not want to give the oral polio vaccine because it's a live vaccine and it can kill the patient or cause polio in the patient. The MMR is a difficult one, and so what they do is they break it down into whether the patient has mild or moderate immune suppression. That's going to be based on CD4 counts and all. If they have mild or moderate immune suppression, then they may go ahead and have the vaccine. If they have severe immune suppression, full-blown AIDS, then the vaccine is not indicated. The other vaccine that you need to worry about with HIV is the influenza vaccine, and that one actually is indicated for everyone because the disease is very common and the disease can kill you, and there have been no reported adverse or deaths or events with the vaccine in those patients. Patients who have had malignancies, you want to avoid the live vaccines simply because they are immune suppressed. Patients who have had transplants, you have to avoid the vaccine because they are also immune suppressed so they don't reject their transplanted organs.